For the elderly, a stay in hospital can be daunting. Recovery can take weeks. That puts pressure on hospital beds and budgets. But here at Bromley, medical staff are making bold changes. They're piloting a service called PACE, Post-Acute Care Enablement. It allows hospitals, community services and social care teams to work together like never before.
You're doing quite well and they're thinking of getting you home fairly soon, if not today.
PACE is about getting patients like Dorothy Reeder back home as soon as possible. Dorothy is recovering from a fall. She no longer needs the medical expertise of acute physicians. Now a community team can take over.
Well, it's just that you're used to being at home and you know where everything is, don't you?
PACE is redefining where acute care ends. Instead of waiting for patients to be discharged, community teams visit wards and draw out patients who prefer to receive their medical care at home.
You have to have all three components and you have to have all three people buying in and the management resources that support those three areas of clinical practice.
And although there's been a lot of talk about collaborative working before, this pilot's actually shown that this is really one team. You're incorporating the acute health, the community health and the social care elements.
There's a consensus that joint work with the NHS is very sensible and there's no alternative. There's no point to having turf wars. We're concerned about adults and older people whose health is important and who want to live at home. We're both concerned to make sure that happens. It's a joint endeavour.
You've got one team that you see in hospital, you see out in the community. It's the same people, you've got the continuity of care. And at the moment our patient satisfaction survey shows 84% of people extremely satisfied.
The evidence shows PACE is high quality care at a lower cost to the economy. The providers have concentrated on outcomes rather than limiting themselves to tariff-prescribed activities. They invented a patient-centred, lower-cost service and then moved the money between themselves to sustain the change.
The payment mechanisms that we have currently across the NHS haven't really enabled commissioners to commission this type of service directly without bearing the risk of potentially paying for services twice or maybe even 3 times. Whereas the fundamental difference with PACE is that we actually align the providers so that they determine the realignment of resources themselves. So there's no additional cost injected into the system.
So when applied with collective purpose, Lord Darcy's focus on patient-centred care and clinician-led innovation has a meaningful part to play in resolving the challenges facing the health service.
This is clinician-led, evidence-based, good care that is lower cost. The alternative under the current economic circumstances is you have to make severe and brutal cuts. I don't think anybody wants to do that, so we need to start supporting this type of initiative.
Joyce Payne was allowed home under PACE. Despite having pneumonia in both lungs, she was able to leave hospital after a week.
Oh, they were wonderful. They were here from the moment I got out of hospital. They were here when I needed them, when I was at my most vulnerable.
For medical teams, PACE could be the solution to successful healthcare. For patients, it's about recovering in the place where they recover best.